Hello, everyone. Welcome to our first SJC Student Alumni Conversations hosted by the St. Joseph's College Student Government Association and the Office of Alumni Engagement. My name is Brianna Ferguson, and I am the president of SGA. I want to thank everyone for coming today, especially our student club members and our president of our St. Joseph's College Long Island Alumni Association Board, Mrs. Melissa Henn McCaud, class of 2001. It's very nice to see everyone. Everyone is here today because you're all interested in learning more about effectively managing students with chronic illnesses in the classroom. Whether you are a student or part of our St. Joseph's College Alumni Association, this interactive presentation and Q&A session intends to highlight a hospital school teacher who provides organizational and academic support to long-term pediatric patients. Also, a demonstration of our new online platform, Sjcnyconnect, will be provided by our Assistant Director of Alumni Engagement, Allison Schmidt. To start off this afternoon's program, please help me in welcoming Cara Giannillo, class of 1989. Cara is a proud SJC alumna and an experienced educator with over 25 years in the education, hospital, and healthcare industry. Currently serves as the hospital school teacher and a member of the St. Joseph's College Long Island Alumni Association Board. Cara received her Bachelor of Arts in Human Services and Master of Science in Education in Elementary Education and Teaching. She also has her New York State teaching certifications in General Education, Nursery, Pre-K, and grades 1 through 6, and Student with Disabilities, grade 1 through 6 by New York State. Cara is also part of an SJC legacy family, as her son Nick graduated from SJC in 2018, and her daughter Adriana will be graduating in May. So please welcome Cara Giannillo.
Hello, everyone. I'm so excited to be sharing my work with all of you. And I hope you become as impassioned and empowered about this very important topic as I am. So I'm very excited to be sharing my work with you. So effectively managing students with chronic illness in the classroom. Okay. So we're going to do a quick poll of the audience. I'm interested or currently working in the industry of A, education, B, healthcare medical, C, other, D, undecided. Okay, great. So I see a lot of you are educators, and that is great because although I love to target healthcare as well and others, especially psychology majors, this is great, and I'm thrilled to be sharing all of this with you. Okay, so my goals today are basically to talk to you about keeping students with chronic illness in school, how to support the medical, psychosocial, and educational needs of students with chronic illness, both when they are hospitalized, at home, or in the school setting, finding ways to meet the unique educational needs of students with chronic illness, and define the very important roles of the stakeholders, including parents, school team, and the medical team. Another poll. Whoop. Can you find the student with a chronic illness? And I'm not seeing the poll part on there. Okay, here it is. Okay, I think we have a few more coming in. Okay. So basically, everyone said no. I like the I don't knows, and the yes I find a little bit interesting. So I'll go on to the next slide and explain why I find that interesting. Okay, so you don't really know a person is sick, said no invisible chronic illness sufferer to another. And the answer is really no. Chronic illness can be visible, can be visible a chronic illness is not visible from the outside unless a child maybe is going through a treatment for cancer and is having chemotherapy. Their facial features, and they would be without hair. But generally, any child with a chronic illness or anyone with a chronic illness, you can't spot them in a group of other children. So what is a chronic illness? A chronic illness is defined as a health condition lasting 3 or more months. And it's a disease, it's not prevented by a vaccine or cured by a medication, nor do they just disappear. 1 out of 5 children under the age of 18 years of age has a chronic illness. And for every 25 students, 5 will have a chronic illness, and as many as 3 will require academic interventions or medical support during the school day. So what are some chronic illnesses? Is ADHD, asthma. I put autism because autism, although that in itself is not a chronic illness, many children with autism have chronic illnesses that actually increase the autism behaviors. Autoimmune disorders, which could be a thyroid disorder, cancer. I put obesity in here because obesity is a chronic illness. Just like that with anorexia or bulimia, obesity is a chronic illness that affects the school performance of students. So what is the impact on education? So when a student has a chronic illness and they're diagnosed, they have a medical, psychosocial, academic impact, as well as frequent absences. So, and this is so the diagnosis, treatment, side effects, how it affects them, how they feel about themselves, how are they going to stay on track in school, and frequent absences or prolonged absences cause interruptions in academics. So we know that the education and health care leaders all agree that the health of children and their school performance are dynamically intertwined. So I often think of myself, hey, if I have a headache today, I'm not going to be 100% in my work performance at times, because the headache is going to be something that is interfering with my work. And that's the same thing for a child with chronic illness. Their illness is interfering with how they can perform in school. So we know that the number of chronic illnesses is rising, and 20% of students are diagnosed with a chronic illness today. Chronically ill students miss more school than their healthy peers, and the chronic illness impacts them both academically and social emotionally. And school is one of the only places that kids go to feel like a normal child. It's part of their job, it's their routine. So the medical impact stays with the child and the family before, during, and after diagnosis. And medical treatment affects this academic functioning because it causes reduced stamina, fatigue, nausea, irritability, anxiety. Students are often tired and drowsy from lack of sleep and also from medications. That causes their attention span to be decreased, and the lack of attention span can cause learning disabilities and memory loss and impaired learning. Many parents feel guilty and worry that they did something wrong to cause their child's illness, but it's important to understand that nothing anyone does causes a chronic illness. Okay, so then there's the psychosocial impact, which also happens at diagnosis. The children and families are thinking, well, why me? Why did this happen to my child? And it's something both the family and the student cannot stop thinking about. It's constantly on their mind. They're constantly worrying about it. They can't sleep, they can't concentrate, they're overly jittery or stressed, and they avoid any reminders of the illness. So if a child has a medical appointment after school to manage their chronic illness, they may not tell you that because they don't want to be reminded throughout the day that they're leaving early because they have to go to the doctor for a medical treatment. 1 in 5 children and parents experience acute stress at the time of diagnosis that benefits from additional support. So moving forward, this psychosocial impact is something that stays with the child and the family throughout the medical journey. So they're persistently worried and feared about the illness, its long-term effects. There's fear of dying, fear of a hospitalization or a medical procedure, fear of a relapse. Sometimes children with cancer return to school, they're perfectly fine. And then, in the back of their mind is, oh, is this going to happen to me again? Am I going to relapse? They're persistently sad, angry, irritable. Their mood can change, often throughout the day, depending on how they're thinking about their illness. Change in self-esteem. They don't feel as confident among their peers. They're concerned about their physical appearance and body images. Behavior problems that weren't there before may start to happen just because the medical journey is so scary for them that they want to act out. It's like they want to scream all the time. And there's social difficulties, especially getting teased. The educational impact is also something that plays a major role for these children. So school, as we know, is the place where children go to learn, socialize, and stay connected to their peers. They experience success, they become independent, and they're just a kid. Oftentimes in the medical setting, who are they talking to all day? Doctors, nurses, the teacher, the social worker, the psychologist, the respiratory therapist. There's not many other children around. And if there are children in the clinic, we try to isolate them because they're immunocompromised and we don't want, them sharing any germs with one another. It's kind of like us now wearing the mask. We're trying to protect everybody else. They're constantly protecting themselves and other people. So in a clinic or a medical setting, they can't be a kid. So school is their job. It's the place that provides hope for the future. And like I said, they're viewed as a child and not a patient. So educational impact is also frequent absences. So children with a chronic illness who cannot attend school are provided with homebound or hospital instruction. So for elementary students, from K to 5, they get 5 hours per week. And that's usually 1 hour per day, but oftentimes, parents say, well, can you come 2 hours one day and then an hour each additional day? It's basically hospital instruction. I do, 5 days a week, an hour a day. Sometimes I break it up into half-hour increments, depending on the child's day or how they're feeling. The same with my high school students. I find that 2 hours constantly with me by the bedside is too much. And parents often say that when they go home, the 2 hours is too much for them. So it's all a matter of, being a team and working together with the school and the parents, or myself and the parents and the medical team. So approximately 1/2 of children with chronic illness are absent 4 times more than their average peers. So I came across this infographic, which I actually is one of my favorite parts of the presentation because it really puts into perspective of how every day counts. So if we look at the bottom line on the first one, it's like 3 days per week. If a child misses 3 days per week, that equals 120 days per year, which is 24 months per year, and that's nearly 8 years. So if you think about a senior graduating from high school that has a chronic illness that has missed 3 days a week for 8 years, they are losing 8 years of school. So technically, we could look at them and say that they're like almost a 4th grader. So it's really important to make sure that we bridge that gap and provide the educational supports that we can when we know a student has chronic illness. Additionally, minutes count, and every minute counts. So an hour a day is a student would lose over 2.5 years of school. So it is important to make every day count. And, even for myself, sometimes I feel like I can't get to, it's hard for the student to sit with me for 2 hours. Their illness is impacting them in the hospital setting, and it's difficult for them. Like I am currently working with a student right now who has a rare genetic skin disorder. where he's basically in chronic pain all day, even with medication, and he's bandaged, basically from head to toe. So trying to get 2 hours of school out of him every single day is exhausting for him. He's in pain. He can't keep up with the work, but he perseveres. And, my goal is to make every second that I am with him count for him academically. So, we have to always find the silver lining in the cloud. So the educational impact is there's academic difficulties. These children have difficulty meeting curriculum requirements, not only because of the impact of the chronic illness, but also the impact of the illness. So their concentration, memory, attention speed, processing speed could be a little bit slowed down just because of the chronic illness, and B, because of the treatment that they're receiving. And they always feel like they're playing catch up. And they have increased anxiety due to this. And the illness, this is really important, that a child with a chronic illness does not automatically have a learning disability, but the illness can increase a prior history of a learning disability. So if a child already has some deficits, the chronic illness can increase those learning difficulties for the student. So here's some effects on educational and school performance. Handwriting, because some medications cause hand tingling and neuropathy, so they can't really hold a pencil correctly. Spelling, it's hard for them to remember the order to put the word, to spell the word. Reading and comprehension, because it's just difficult for them to concentrate. Understanding math facts and concepts. They have difficulty sequencing, auditory and visual processing. So for me, every day, I am including all of these in what I do with my students. I do a lot of hands-on crafts. I play a lot of math games, just because I find that when I do this, it helps them to feel more successful. There's short-term memory and information retrieval. We have to give these students a little bit more wait time, because it takes them a little bit longer to process our questions, and therefore it takes them a little bit more time to give us the answer. They have difficulty with planning and organization, and their social maturity and social skills, as I said before, is really basically behind because they're not interacting with peers their own age, and because they're around adults for a significant part of their life. Psychosocial impact. So we focused a little bit about the effects of prolonged absences, and prolonged absences have a really distinct effect on how a child looks at school when they're returning to school, even after a short absence. So the prolonged absence causes a fear of rejection, and then they have difficulty adjusting to the social demands. So if they're absent for a long time, like some children treated for cancer are absent for 6 months, because the beginning phase of a treatment protocol has them immunocompromised and their body is suppressed, and they have a lot of treatment. So they're out of school for at least 6 months. So they could be diagnosed in the beginning of, middle of 11th grade, but they're going back to school as a senior. So they're going to have difficulty adjusting to social demands. So then they start to avoid the interaction with their peers, and then they have a concern about physical appearance. And when I think of this school refusal slide, there's one girl I have in mind in particular of when prior to me transitioning to my current role, when I did school intervention, we had worked out a fabulous plan. Well, we thought it was fabulous, that she would go to school intermittently, have an intermittent schedule, that she would go in the morning for only math and science lab, and then she would get home instruction in the afternoon for the other subjects. She had an identical twin sister, so she was going to be in the classes with her twin. So we set up the plan, we had the school meeting. Mom went to drop her off at school. She broke down crying, and Mom's like, we worked out this schedule, what's the matter? And she's like, I'm bald, and I used to have long, beautiful dark hair. I can't go into that school building. Nobody's going to know who I am, and I can't face answering questions about what happened to me. So although we want to always focus on the educational piece, and we thought, wow, we have the perfect educational program for her, we, even as professionals that do this every day, kind of forgot about that psychosocial piece. And that's very important. Almost just sometimes I find it's just as important. I'm focusing on getting these children back to school as the educational plan. So everyone is affected. So when a child is diagnosed with a chronic illness, the parents and the siblings are affected, the classmates are affected, school, friends, and the community, because that child is now almost like taken out of what they see as normal. So they're not going to be going to soccer practice or cheerleading practice every day. They're not going to be staying after school for a school activity. They're not going to be participating in a concert. So it not only affects the child, but it affects everybody that child is connected to. So everyone is affected. And I always look at it, yes, everyone is affected, but the student is obviously the most affected, because everything changes for them. And it's basically in a second of a diagnosis. They have to deal with the medical condition, the body image, lack of control. They have absolutely no control anymore. Everything that they know is normal is now taken away from them. So, and they have to, build a whole new set of normalcy for them, which is doctor's visits, hospitalizations, teachers coming to the house, teachers coming to their hospital room, and they're socially isolated, because a lot of children in the beginning stages of a chronic illness, especially if it's cancer or something where their body is immunocompromised, they can't be around other people. Parents are affected. Parents are also affected immediately at diagnosis, but when it's time for them to return to school, they have a lot of fear. They're unsure of their role. How does their child now keep up with schoolwork? Were they adequately prepared with home and hospital instruction to now meet the rigors of the school day? And there's one piece that I really like to hone in on, is that they feel like the school has lack of educational resources, and also additionally is that our schools have inconsistent school policies. So one school district may say, hey, we know that your child has a chronic illness. Whenever they're absent, we're going to have a home instructor come for them and keep them current with school. Another school district will say, well, our policy is that you have to be out for 10 days. So if the child's not in the hospital and I don't pick them up for services, and the school's not going to send the home instructor, that child loses 10 days of school before any instruction kicks in. So it's really important to have an advocate, the parents and myself or the medical team to kind of advocate a plan at reentry for these children, that they will be absent intermittently. They might have to go to the clinic for an appointment. They'll be absent the whole day, but have them be able to catch up on the work. Teachers, I always feel like everybody thinks, oh, you're a teacher, so you know everything. And it's like, well, we know a lot and we know the curriculum, but we don't really know anything about medical knowledge. So when a child returns to school, or a child has a chronic illness and they're in their class, they're afraid. You're afraid what happens to that if something happens to that child during the school day. They don't have the medical knowledge. They have medical misconceptions. They don't know the rules and policies related to the well-being of the student. And they're really unsure of classmates and parental reactions. And they're really not the one that has to field all of those questions. So it makes it difficult for them. Siblings are also affected. So siblings are just as affected as the parents and the child. And if you know that you have a student in your class that may have a chronic illness, you may want to reach out to if there's a sibling in the school, to that child's teacher as well, because these are some of the things that this teacher might see: social withdrawal, crying, their mom or dad and their sibling is in the hospital and they don't know what's going on. So they're afraid. So they may start crying. Their frustration level becomes really low. They may rebel. They may become inattentive. And one really interesting effect is that they become an overachiever. So they may, work extra hard to get straight A's. They may go home and start cleaning the house, vacuuming, doing things that they normally didn't do. And that's because they don't want their parents to have another disappointment. They're afraid that they don't want their parents to have to deal with, oh, I have an F, or, oh, the house isn't clean when you come home. So these are all just things like that siblings face as well. Okay, so what can we do? So we need to bridge the gap immediately between the medical team, the hospital team, and the school. So there are school reintegration or reentry programs that help to do this. There's many of them that are countrywide. Many children's hospitals have educational liaisons, and basically what a school reintegration team does is to provide the medical, psychosocial, and educational impact that the chronic illness causes with the school team. And they set up 504 plans, they may set up a health plan. They kind of take all the things that we would think that a parent would do. They kind of take that all away from the parent. So the parent could focus just on getting the child well enough to return to school. But the reentry team sets up, for me at Stony Brook, there's a reentry team for children with cancer and blood disorders. So anytime a child is diagnosed, the reentry team reaches out to me to start hospital instruction. They're also reaching out to the home school to get home instruction started. They're also starting to request what accommodations the child will need. So they are really play a very significant role in advocating for students with chronic illness. I personally think every child with a chronic illness needs to have a school reentry team that advocates for them, because every chronic illness has its own very unique characteristics, and they each impact education differently. So they really need somebody to liaise between the hospital and the school, and the parents and the school, to help them advocate for the best academic plan for their child while they're working towards recovery. So how do we stay connected? So this is really great for younger children that are out of school. Well, now we have Zoom, we have Skype, we have FaceTime. Vigo is an amazing robot that a child from home could actually attend class through the robot. And then when they change classes, they could remote control the robot throughout the school. So they have a presence in the school, with the robot. Another favorite of mine is to share notes, a collection box, photos, class updates that could go back and forth, either with a sibling or a neighbor. And the students share notes with the child, and then the child is able to share notes back with the student. There's also, for younger children, something called Monkey in My Chair. I have that on my resource list, but it's a program that leaves a monkey in the child's classroom that shows a reminder that the child is still part of the class setting. And this is just a little bit about that. So how do we put these pieces together? So there are a wealth of resources to support the whole needs of an individual with chronic illness. Many organizations out there have resources for chronic illness in school. And, you could Google cystic fibrosis and school, and it would help you as a teacher or as a school social worker, as a school psychologist, of some of the interventions and recommendations and resources that you could implement for that child to help them navigate through the school day. And these are also on the resource page. Okay, so there's really great news for this population, that with the support, the interventions, that we could really improve those educational outcomes for students with chronic illness. Okay, so we're going to poll the audience again. So to what extent did you find my or Cara's presentation interesting, informative, and engaging? A, very effective, B, effective, or your C, not sure. Okay, well, I appreciate that. I always like to share what I've learned over the years and how I've, brought so many pieces of my journey since I graduated from St. Joe's together to serve this very unique population of students. And I appreciate that you were interested in learning more about it. Okay. So I think that my part is done. I think Allison's gonna come on now, correct?
Yes.
Okay.
Thank you so much, Cara. That was an unbelievable presentation. I think we all really learned a lot, and I'm glad all the students on here found it to be very effective, as we asked in the poll. So I'm gonna transition into a quick commercial break. Out of the Office of Alumni Engagement, we have launched a new virtual platform called Sjcnyconnect, which is a platform for the SJC&Y community to engage, exchange, and empower with one another. If you are a student in the class of 2021, you did receive an email from our office asking for you to sign up for the platform. But I am going to give a demonstration of what this platform does have to offer. Just going to share my screen here. So this is Sjcnyconnect. This is what you would see when you log on to the platform. We have our mascots up here greeting you. But the first feature I want to talk about is Grad Live, which is this right up here with the green dot called Who's Online. So it shows you real time who's actually on the platform. So if I was interested in connecting with Ozma, for example, I would just click on her profile and be able to send her a request to video chat in that moment. So that really helps with real-time networking, which is awesome. We also have news widgets on the side. So this is the year of St. Joseph, so we've updated that there. We have our Giving Day coming up. We typically have news from the president's office, articles, Zoom backgrounds, and just our social media down here as well. Then in the center section, we have our news feeds. You can see Stephanie, someone from our team, posted about the Women X conference last week that happened. St. Patrick's Day greeting. We advertised this event in our news feed. So just different things like that we put in the main section here. Then I want to transition into the directory. So the directory is where everyone on the platform is housed. So currently we have about 330 users. But what I want to highlight within the directory is the mentors. So our SJC mentor program is actually housed on this platform. And I'm going to use Cara's profile as an example. So if you toggled onto the mentors tab, you can go into any of these profiles and see what the alum is willing to help or offer you in terms of mentoring. So Cara is willing to answer industry specific questions, virtually meet for coffee, and she's offering to mentor a student or a young alumnus and give career advice. So that's just an example of how you find a mentor on the platform. Additionally, you would be able to go into the mentoring tab and actually get suggested matches based on your own industry. So a lot of you are in education, so you'd be able to look for mentors within the education industry. Then we also have a job board on the platform, which actually is integrated with Handshake. So I know through the career office, you all have an account with Handshake. We also have the ability for alumni to post jobs on the platform as well. So we have a few of those up here. We have a photo section with some pictures of past in-person events. So hopefully we'll be getting back to that soon. We also have a groups feature on the platform. So some of the affinity groups we've been targeting so far are the accounting program, career development office, the athletics groups, chapel players from the Brooklyn campus, and our virtual knitting group for alumni. We have an event section as well. So again, here's the event for today and the rest of our event offerings for the spring. And then we have a resources page. So if you're looking for more information about the mentor program, for example, you could find that right in here. If you need extra assistance, my email is in there. So we would be able to connect one-on-one and I can help you find a mentor. And that is Sjcnyconnect. The link to sign up will be in the follow-up email. And again, if you have any questions, feel free to contact our office and anyone within the office. I'm going to pass it back to Brianna.
Okay, thank you so much for the demo, Allison, and thank you for the wonderful presentation, Cara. We do have some questions for Cara that were pre-submitted, and then I did see that in the chat we had some. So after our pre-submitted ones, I will have Ozma regulate the chat to see if we have any further questions. So our first one is going to be, what is the most positive aspect of this teaching job?
Well, the children are the inspiration. That's the most positive aspect. You know, often people say to me, how do you do what you do? Like, how do you do that? And I'm like, you know, how do you go into a room and a child is like hooked up to an IV or whatever? And I said, I see that in the first second. And then once I have a conversation with them, I see their heart, and that's all that matters to me. So it's just, I find inspiration in them. They are just like warriors. They make me smile every minute. They have the best sense of humor, even when they're like sleeping and I'm reading them a story and I say, okay, I'm going to leave. And they're like, no, don't leave. I know what you said. It's just, you know, in this world, it's like, it just puts your whole life into perspective, and they're just the highlight of my day, besides my own family. But, you know, they're inspirations.
That's awesome. That's really sweet. On the other aspect, we have a question asking, what's the most difficult part of this teaching job?
The most difficult part is when you're working with a student and they're hospitalized and you think they're doing great, and every day you walk into the room and, you know, I say, okay, what time are we going to do school? And they're like, right now. And then you go home for the weekend and you find out that they declined and that they're in the PICU, and, you know, a few days later they may pass away. And, you know, it's that unknown is always the most difficult part.
Definitely. And how has being in this position changed you?
Well, I've always been empathetic, but I think it's made me so much more empathetic. It's made me so much more grateful for the things, you know, that I have. But like I said, you know, it's just these kids and their families are an inspiration to me. So it's just like almost like a breath of fresh air. It makes me just be grateful for everything that I have. I want to share that gratefulness with all of them.
Right. Okay. So other than being a hospital school teacher, what other positions have you had?
Well, when I left St. Joe's, I actually was a staffing coordinator at Syosset Hospital. So I started my career, I guess, like in the medical field. And then I was a caseworker and independent living skills coordinator for adolescents and foster care. So after leaving that hospital position, I kind of segued into like casework, social work. And really, you know, after 10 years of that, kind of felt like, well, where am I going to go next? Am I going to get my master's in social work? Am I going to get my master's in education? I always wanted to teach, and because I was teaching independent living skills, I thought that that would be, you know, the natural place to go. And I got my master's. I had my family. I did different jobs. I was a parent visitor for the Parent-Child Home Program, which was an early intervention, early literacy program for underprivileged families. Then I taught. I did several kindergarten leave replacements, several 5th and 6th grade leave replacements. I was a long-term sub, and then I was kind of feeling like, well, where am I going? Because teaching is so hard to get into. that I stumbled upon the school intervention and reentry program at Stony Brook Children's Hospital. They were looking for a part-time liaison, and I applied for it. And that just really set my, career journey, in a totally different direction, because then I became the advocate and learned so much about it was really cancer and blood disorders that I really focused on. And then I started missing, I'm always looking to change. I started missing, working with kids, because even though we do the classroom presentation, it's not every day. So I said, oh, wow, what am I going to do? I don't want to really leave school reentry, but let me just put myself out there and start, seeing what's out there. And I applied for a position at BOCES, and I interviewed and demoed, and they called me in and they said, we're opening a classroom at Stony Brook and we think that you would be perfect. And I said, oh my God, that's like my dream come true. So it just I just, I look at my life as like it is a journey, and each stepping stone of where I am leads me to the next one. So I never thought that I would leave teaching to do school intervention and reentry, but that actually changed my life, because then I was able to actually find my next position and of teaching the children in the hospital. And I had so many colleagues throughout the country that I would go to conferences to, and they would be like, Cara, you need to be the teacher in the hospital. I'm like, but they don't have one, and I can't move to Cincinnati. I can't, so it worked out when the timing was right.
That's amazing. A lot of different experiences to really build your career there.
Right.
Segueing into the next one and the final one before I move on to Ozma's questions is, what advice would you give to individuals who want to enter this field? I feel like it's definitely a unique one and something that people might not think is an option as an educator.
Right. Well, it is very unique. I'm the one, based on Long Island at Stony Brook Children's Hospital. I know Cohen's Children's Hospital works with the New York City Department of Education. So they have a home hospital school branch. So if you're interested in this type of work, I would say New York City would be the place to look for this program. There's a tutoring company called Education Inc. They provide bedside hospital instruction to Good Samaritan Hospital. But it's just on Long Island, it's a very unique position. But in other states that have huge children's hospitals, in Ohio, they have 3 or 4 children's hospitals. They have hospital teachers. They have 15 or 20 of them. So, but I just think that in the classroom, if you have having the knowledge of your students, if they have a chronic illness, and becoming their advocate is really the place to start.
Awesome, thank you. Ozma, do we have any additional questions for Cara? I believe there was one about a teacher in the classroom dealing with this.
Yeah, thank you so much, Brianna, for having that amazing Q&A session. We have a couple more questions that were asked in the chat box. So the first one is, if one of our students needs to leave mid-school year to get treatment for a chronic illness such as cancer, how should we, as the teacher, provide support to the student and their family?
So basically, kids with cancer and blood disorders that are treated through Stony Brook Children's Hospital, they have an amazing school intervention and reentry program. So they'll work with the school to set up that homebound and hospital instruction basically is immediately. I would say what I find the most difficult is the sharing of curriculum with me. A lot of teachers feel oh, well, you're a teacher, you should know the curriculum. And it's well, every school district has a different curriculum. So just sharing what you're doing in the classroom. I just feel I'm not going to steal your work. You know what I mean? I just want to be able to support the student. So should you have a student that has a chronic illness, cancer that comes out mid-year, is to have an open dialogue with whoever the hospital teacher is, whoever the home instructor is. Share your resources, because that way you're making it a smooth transition for them. Because when there's gaps in the curriculum or gaps in that transition is where the students start to fall behind, where they start to feel discouraged, where they lose that connection to school. And additionally is, just keep them as plugged into school as you can. Send those notes home, give a phone call, check in with the parents. Oftentimes parents feel like, oh, I was so connected to the school and now my child has a chronic illness. The teacher doesn't email me, the teacher doesn't call me. It's like they would just, they almost feel like their child is seen as, for lack of a better word, dead now in the school community. So try to just keep them as alive as possible as you can with little things, that you can do. Have the students send home notes every once in a while, draw pictures that then I could put up in, the patient's room and things like that.
Great. So as a follow-up question, we have another question kind of after that. How should we explain the child's absence to other students?
Okay, well, the school intervention and reentry program again does that. But I think that you just explain to them, try to find some information. I mean, if you have a student with a chronic illness, you could always reach out to me and I could definitely, help you with that. But just, we basically say that sometimes, our body is like a puzzle piece, and sometimes the pieces of the puzzle don't fit together in the right way. And such is ill, and they're going to be absent for a few days, but they're at home and they're getting better, and we're going to help them stay connected to school. Based on the grade level, that's how much information I would share. But accurate information is really the most important. And like I said, a lot of the websites for chronic illness have that information, but simple, accurate, and with the most positive details is the best way to explain that, the child's absence. Usually a school social worker or a psychologist will collaborate with you if there isn't like a medical person that could, help you with that. The nurse is a great resource as well.
And another student has a two-part question, so I'll just break it up. Is anxiety considered a chronic illness?
That I'm not like well versed in chronic illness, but anxiety is definitely really related to the chronic illness. A chronic illness causes anxiety. So we could maybe say it's a side effect of the chronic illness, but I mean, I'm not a medical professional, so I don't want to, answer that question.
All right. And the last question that was asked is, if a child has social anxiety and doesn't want to go to school, what is the best way for a teacher to make them feel comfortable in the classroom?
Really, when a child has that amount of social anxiety that they don't want to go to school, it's really beneficial to work with the school psychologist, the school social worker, and if they have an outside psychologist or social worker, because the school anxiety probably is exacerbated by something else that's happening. And that's what we find. That's just the way that they could express how they're feeling. So it has to definitely be more of a collaborative kind of effect. Collaborative teamwork with the school social worker and the school psychologist really intervening and kind of being a contact person for the family.
And we have another question in the chat box. They're asking if Stony Brook has a therapeutic recreation department for children.
Stony Brook has a child life program. They don't have specific therapeutic recreation professionals that provide support, but they have a child life program, and child life is a child development and family development specialization that provides medical treatment like education. They provide distraction type of techniques, so that like when a child is going in for a procedure, how to be distracted, like they do a lot with like showing bubble blowing for asthmatics. So it is part of therapeutic recreation, but it's a more specialized, and it's called child life specialist. We also have art therapy, music therapy. They fall under the therapeutic recreation umbrella, but they're not, you know, most of them are interns that come in and shadow under Child Life.
Great. I think that's all we have for the Q&A portion, and I'm going to send a link to the feedback survey in the chat box. So if anyone could fill that out just to give us feedback, so we can know make any improvements for future workshops, we totally love and appreciate that. So I'm going to send it out right now.
All right, thank you so much. That does conclude our first SJC Student Alumni Conversations. If you have any more questions for Cara, feel free to reach out to her on Sjcnyconnect. That's what Allison was showing you in her little demo. And Ozma did just send the feedback in the chat box. If you do fill out that, you will receive an SJC branded mask. So that's a little something to look forward to. Thank you so much for attending today. We hope to see you all at our next virtual event. Thank you so much to Cara. I feel like we all really learned something today, which is amazing. And I hope that everyone has a wonderful day. Thank you, guys.
Everyone.
Thank you so much.
Have a great day.
You too.
Thank you. Have a great day.